So whenever I heard about the project, I wanted to be involved because I want to give other women hope and letting other people know that it's normal to feel how you're feeling. So getting it all out there and letting other mummies know that it's normal to feel how you're feeling.
They're not feeling good, that it's actually okay to go, I'm not feeling good, instead of powering through, because that isn't going to work. So that's why I want to be included in this.
Very much giving something back, because I suppose like everybody, we didn't know the service existed, and then you reach crisis point and then you step in, and it was like a safety net for sure. So yeah, I suppose just doing something valuable and giving something back would be the main thing.
So I'm hoping to reduce the anxiety and the stigma for women who are experiencing mental health problems in that perinatal period, that they would know who to go to ask for help and what to expect when they ask for the help.
I think from working in the service, you see all the women on this journey from that first really anxious appointment, not being sure what to expect, to then when you're discharging them and the change and the journey that each of them go on. And I suppose just letting other women out there know that things can be different. How they feel when they first come into the service doesn't mean that's the way things will always be, and that there is help and things can get better.
It was as if you were going to be signed into another house. Getting that letter, reading that you were going to Knockbracken for an appointment, it was scary, it was petrifying. I didn't think I could have done it. I actually really did try and avoid it and made sure that I'd cancel one of my appointments and change it because I couldn't face it, because I was too afraid. Here in Knockbracken, you hear, oh, you know, the worst thing, you think the worst thing's going to happen. But when you get here and you see, you get 3 hour first appointment and you realise that there's actually more support and there's more services in it, you know. It's not just about, like Leah says, about medication, it's much more than that. Like there's much more to it. It's like you've also got a friend, someone that's not judging you, and like you're allowed to have your own wee safe space. That's what we've been saying all day, like your own wee safe space. Mm-hmm. The fear of your kids being taken off you, being judged and being shamed.
I do get help, but this is just it, and I won't bond with them at all. That was awful. I just thought it would never change, and then one day it did. But that was what really worried me, because that was just my relationship with my son.
You thought so your biggest fear was you thought it's not going to change?
No, I just thought that was it.
Do you think there are other women out there who share that fear?
Oh, no, definitely. But maybe just don't talk about it.
Like when I was here in May, I was in a terrible way, really, really terrible way. And coming here and the support I received from yourself, Katrina, and Dr. Walsh, I wouldn't have got to where I am now without them. I really wouldn't have.
I think it's important for us, we know what service we provide and what we can do, but I think it's important for us to let the people that are coming to our service know what's available, and also to put them at ease enough to be able to come to that first appointment. I think that's a big first step in the journeys that we'll hear about, and I think us being able to get people to that first appointment and get their journey started is what's important.
I just feel incredibly proud, like proud of each of you in the group, that you are wanting to give back, that you are prepared to share your stories, and I'm also proud of each of the journeys that you have been on, that you are at the point that you can do that. And I feel really hopeful about what this potentially is going to do for other women coming through. I'm so grateful that you are doing it.
I was in a really, really horrible place. So looking back now and seeing how far I've come with the support of the perinatal team, it's been amazing.
It's actually quite nice to talk about it again, because then eventually, hopefully over the next few weeks, it won't be a big deal talking about it anymore.
Go for it. Just do it. Like, don't hold back, because you're suffering. Whenever there is these services that can help you and you won't be suffering anymore. Like I know what that feels like, to be behind closed doors. You're on your own, you're with your kids, and you're trying your hardest just to get up and get on with it every day, thinking that you don't have the help. Do you know what I mean? You don't even know what help's out there. You're meant to have family to support you, you're meant to have like midwives or health visitors or whatnot, but it's like you're invisible. But the perinatal team, they offer like a support that you can get better with. I mean, you can get better. There is going to be light at the end of the tunnel that you seem to be going for.
The first week was definitely terrifying, and I was the whole time. I just didn't speak. I remember you asking a couple of questions and I just didn't answer, because I just felt like I was going to cry the whole time because I hadn't thought about it for months, really, to be honest. And I wasn't going to come back, but I decided I'll go to one more, and if it's still like that, then I'll just leave it. But I really enjoyed the first session, and everybody was really nice. And the other mummies, being around other mummies who were just being as open, was lovely. And now by the end of it, it's kind of been like, I suppose, therapy for me technically, because now I know that it's perfectly okay, and everything's fine now. I didn't think it would be okay, but it's fine now. I am having a great time with my son, and it's lovely, and to know that there is an end is amazing. And this has been amazing because it's just brought it all back up, but I've been able to work through it properly and not hide it anymore and just go, this is what's happened and that's okay. I had obviously one-on-one sessions with my key worker, and they were really good. Don't get me wrong, they were fantastic, and obviously the antidepressants helped too, but coming to this has made me have to think about everything that I felt, everything that was said, and actually go through it all and accept it. And it's honestly been more helpful than anything. So it's just been incredible. It really has. It's beyond helpful. So thank you.
It's been a lovely opportunity to say thank you to the service because they were so good with me when things were really bad. It was lovely to meet the other mums and the other members of the team that maybe weren't allocated to me, you know, in terms of the support. So it was really interesting to chat to them and find out what they do as well. So it's nice to feel like you're part of something that's reducing the stigma around perinatal mental health because it is so common. Yeah, I definitely would do it again. It was quite good fun actually, and just lovely hearing the other mums' stories as well. Yes, so it's then knowing that that period of your life is going to pass is different from feeling that it's going to pass. And there were some pretty dark times last year. Oh, you hurt your nose. But it's lovely to know that hopefully this might help other people who are in the same situation.
I found it really hard. It was really hard to start trying to open up, speaking about how I felt during a time where I don't want to go back to, or I fought so hard to get out of it. But being in the project, it sort of helped and made me realise that it is okay. It is okay to be not okay. And sometimes coming down, it's a bit harder than I thought it would be. But I like to come down because whenever I'm here, I get the support and I realise that it is our wee safe space. It makes me realise that I can speak and I can open up and I can tell how I'm feeling, and it's okay. But I do feel a lot different today than I do from the very beginning. I feel a lot stronger than I did when I only came here. I want the women who are feeling the way I felt at one point. So no matter what way it is, or no matter what it is that you're feeling, I want you to realise that there is help out there, and there is someone who can support you, and there is a team actually that can support you. But I want them to realise it's okay to not be okay.
I think it's been incredibly rewarding to have an opportunity to work with a woman who are at the end of their journey with the perinatal team, to hear their stories, for them even to feel okay sharing their stories, and for them just to be happy and open to use their experiences to potentially help people who might have difficulties in the future. I think for me it just reinforces that importance of, certainly in a service like perinatal, that we're working as a team, that it's not staff kind of saying to patients what we think we should do, that it's very much a joint process and a joint journey, and we're just walking alongside them as they build in their confidence in terms of being a parent. You know, it's one thing working with staff in a service like this, but I think the most from what the feedback that we've got from the mums is that the thing they most benefit from is talking to other people who are walking a similar journey, and being able to share stories and realise that they're not alone, and it can be hard, but it can also get better. So the importance of creating all those opportunities for all that. It definitely surprised me as to how willing they were to share their stories and how willing they were to be open, and then to, I suppose, show that vulnerability and put it on film is just amazing. It's bound to have a positive effect for mums coming after them, and I just think that'll be amazing for them, and I think for the women who've been involved, hopefully it'll just help them realise how far they've come, and it'll almost be that payback for their generosity in terms of what they have given when they realise just the benefit of it. So I think co-production is incredibly important, and especially in a service like this, we need to be guided by the service users and ensuring that we are listening to them and that they are the experts in their condition. We're just walking beside them, and we need to just support that. I want mums who potentially are struggling to see the film, their families, their circles of support, and also thinking about the professionals who might see the film in terms of who might be referring in to the service, so they know who are the women who need our support and when is the right time to refer, and just being able to ensure that everybody has that knowledge at the right time, the right place.